Our next presenter is Dr. Monique Gignac, and she will be speaking on the DCIDE tool and disclosure decision making. To tell you a little bit about her, Dr. Gignac is scientific director and a senior scientist at the Institute for Work and Health, and a professor at the University of Toronto's School of Public Health. Dr. Gignac's research expertise is in health and social psychology, including workplace communication, disclosure, support, and accommodation among individuals living and working with long-term health conditions. Thank you for being here again for the fifth time. Dr. Gignac is a fixture at our summits, so it's really lovely that you give us your time every year. I am going to just hand it straight on over to you. Thank you.
Well, thank you, Melissa, and I'm so appreciative of the opportunity to be back. I'm just trying to get some slides up here. I hope you can see them now. So thank you all for being here and for the opportunity to share some research about deciding whether to share health information at work, and in particular, a new tool that is designed to help workers make these decisions, the decisions that would be best for them. I'm going to start with my takeaway messages so that you'll know where I'm going. And they are that many workers do not share their health or support needs at work, although often people do, and it's wonderful that people are feeling more comfortable doing that. The decision whether to share is often complex, and people will draw on the impact of their health on their work, their goals, their own personal preferences, what they think they have available, and how they feel about the people they work with. What is challenging is that a lot of times this different types of information are simultaneously encouraging and discouraging people to share. And that can be, of course, really stressful. So this DCIDE tool, which is disclosure support for communication of invisible disabilities that are episodic, helps workers consider whether to share some personal information, and I'll walk you through the tool. I do want to say right up front, the tool's available for free in English and French. We do not ask for personal information. We do not save your personal data, and it links to a variety of other resources that can help with support and accommodation. I didn't tell you a lot about myself. I'm not going to. And the reason is very simply because although I'm presenting today, I'm in fact just one of a very large group of people who have worked on these tools over the last several years. We've called ourselves ACED, Accommodating and Communicating About Episodic Disabilities. We have an expert advisory committee of people with lived experience, very different types of lived experience. We have a lot of different researchers with different skills and experiences. We have been funded by 2 federal granting agencies in Canada, and we have a lot of community partners. And I really want to acknowledge their input, and particularly Realize. Realize has been part of the last 7-8 years of this journey of creating tools, and they've been a really tremendous support. So thank you very much to everyone at Realize. What I'm going to do is just start by setting the stage a little bit, talk about disability numbers, talk a bit about why disclosure decisions are so difficult and what some of the research tells us, tell you about the tool, and then I'm happy to answer any questions that you have or address any of your comments. So in terms of disability in Canada, Statistics Canada tells us, and you may know this already, that there are about 8 million Canadians who report living with a disability. That's about 27% of our population, and this is very similar in the European Union and the United States. About 61% of people tell us that they don't live with constant limitations, but that their limitations can vary from periods of time where they have no challenges, they can do everything that they want to do, to other periods of time where they have episodes or more severe limitations. For about 23% of people, over time, their health is often getting worse. There's about 13% of Canadians who will say it's highly fluctuating. And then we have about 25% of people who will say they can go for a month or more, often years, where they don't have any limitations, but then, may have an episode. Often, the disabilities are unpredictable and invisible, as we've been hearing over the last couple of days. And by what I mean by unpredictable is a person can be doing everything they should be doing to manage their health and still have a period of time where they have an episode. And of course, others may not be aware of what one is living with. I've put down a number of common mental health conditions, as well as physical conditions. We heard just a few moments ago from Melissa with transplants, kidney transplants. There are a wide range of things that can be considered as episodic. In a workplace, what does this mean? Well, the changing and the unpredictable and invisible nature of disabilities often creates challenges in two big areas. The first is around disability communication, disclosure, and protecting privacy. And the second is in providing support or accommodations to help people maintain productivity. And again, you've been hearing a lot about that. What we've done as part of this grant is we've been trying to address these issues by creating some resources for people to help them to do more of what they want to do. So we have this DCIDE tool, which is really aimed at addressing the question of, should I say something? And we have something called the Job Demands and Accommodation Planning Tool, or JDAPT, that addresses what can I do. And I've been at previous summits talking about the JDAPT. I hope you'll check both tools out. I've got the link here. I'll have it on other slides. You can actually Google JDAPT and it'll come up, or you can Google DCIDE and it'll be one of the first couple of sites that come up if you're interested in trying out the tools. So let me, before I go into the DCIDE tool in detail, tell you a little bit more about what we've learned and what others have learned about sharing information and why these decisions are so difficult. So first of all, in Canadian surveys, if you look across them, you'll find that about a quarter to nearly half of people will say that they have not shared any information about their health with their supervisor, either a physical or a mental health condition. People are less likely to share if they have a mental health condition. And there are a lot of different reasons why people decide not to share. I've put down some here from a survey that we conducted a number of years ago. And it's important to note that people often have many reasons, and some of them are that they can manage at work without others knowing, and they prefer to keep things private. They don't feel people have a right to know necessarily about their health. Often people will say that it doesn't affect their ability to do their job right now. More worrisome is when someone says nothing can be done, so there's no point in discussing. And we heard that from just over half of our participants. And why that is disturbing is because very often something can be done. There are supports that often can occur to help people sustain their work better. People can also have concerns about their reputation. They may not feel secure in their job. They may have seen others not be treated well or have had bad past experiences themselves. So there are a lot of good reasons why people don't share information. In terms of what we know from people who have made a decision, there's no one right way of doing things. So people who have disclosed will say that sometimes they have received support, they've got that greater understanding, it has been the right decision for them. Other times, unfortunately, we hear from people that they feel they have to prove themselves all the time now. Everybody's watching them. They may experience stigma or gossip or a loss of reputation as a good worker. Sometimes that means people will think, well, then I'm not going to say anything. And that may mean that you have less stress, less concern about how others view you. But of course, if you do need some support, you may not get it. And so that can be one of the negative consequences of not sharing. And we hear that sometimes there are misperceptions about the reasons people are having for job difficulties. And we hear a lot about this when people experience pain as a common symptom, or fatigue, or mental health conditions, that sometimes we leak information. Others are noticing we don't seem to be ourselves. Something's different. And in the absence of knowing what's going on, they may jump to conclusions that this is a performance issue. This is a person who's not motivated. They don't have good skills. They have trouble getting along with others. And so a negative consequence of not sharing sometimes can be these misperceptions that people have. Why are so that's some of why these decisions are so difficult. Other things to keep in mind that I know many of you are very much aware of is there's sort of what I'm calling the mechanics of disclosure. You need to consider a lot, not just whether to share, but with whom you're going to speak. When are you going to say something? What do you want to say? How much? Whether this is face-to-face or by email. So what's the mode of sharing? There's a lot to go through in your mind when you're thinking about sharing. And this isn't a one-time decision for most of us. It involves multiple decisions. Our health can change. Who we work with can change. The job can change. So lots can go on. That means this is something people have to consider on an ongoing basis. I've already talked about the fact that we don't know for sure what the outcome will be. So you can have a lot of concerns about your career, your reputation, losing control of information. But I do want to again remind you that the research is both positive and negative. It's not all negative with sharing, and we've heard stories about the positive side as well. And then the final thing that's really important is that people have to consider different types of information. Are we going to prioritize, how we feel about our colleagues over the impact of our health on our job? How do we balance information? And are there patterns of decisions that we can learn about to help us? So this is really what we were focusing on in addition to these other aspects when we created the tool. And essentially, when you look at research and when you talk to many people who are going through these decisions, there are a number of areas that people focus on in making their decision. The first is, what is the impact of their health on work, and how does work impact your health? People will have goals in making decisions, so they sometimes want information, they want access to supports, but often they want to protect your finances, you want to protect your job, your reputation. People will have different personal preferences. Some people are happy to share, or they feel they have an obligation to share. Others are much more private. They may have had negative experiences in the past. There will be what's available to you in your organization in terms of potential benefits and supports, and how do you feel about the people you work with in terms of their supportiveness. So and I guess what I want to say here is that very often what we hear is that some of this information, when you think about your own personal experience, will be encouraging you to share. But at the same time, some of the information that you're considering may be discouraging you from sharing. So there's this push-pull that's going on for many people. In a particular study that we recently did that had nearly 600 people, we heard that about 58% of the people in the study had shared, 42% had not shared anything with a supervisor. People are more likely to share something with at least some colleagues, and some people are happy to share with everyone, but still about 30% of people hadn't shared anything. If you're working in a larger organization that has a HR or a union or disability managers, you'll see even fewer people will have shared to these individuals. And that's largely because people wait to share here until they really need to say something. And we heard that for about 2/3 of people in the study, they felt quite a bit of pressure in making a decision. It wasn't a comfortable situation for them. So just a little bit more about this push-pull in terms of using information. We had about half of people say they had a considerable impact and a need for support in their job. This was their health had an impact and support would be helpful. People saw sharing as being helpful if they did have accommodation and information needs. And in this sample, we actually had 78% of people who said they had supports available, which was quite good. So all of this, you would think, would encourage people to perhaps say something. You have needs, getting accommodations would be helpful, and you do have some supports available. But at the same time, we heard from people that mostly their top goals were not getting accommodations. They were protecting their jobs, protecting their financial security and their reputation. Although about a third of people were willing to share and thought it was important, just over a third were very reluctant to share personally. And about 20% of people said they could see the positive and the negative. They were really feeling torn, didn't know what to do. When it came to perceptions of their workplace, we had about 58% of people said the culture is really quite positive here in terms of supportiveness. About 16% saw the good and the bad. And so they were unsure. And about 1 in 5 people in the study said, no, I don't think the culture here is conducive to sharing. I don't think it's safe for me to share. You'll notice these numbers don't add up quite to 100%. There are a group of people who just don't care. It's not a big deal. So I don't really have any personal preferences, and I don't know what my culture's like in my workplace. When we looked at this further, and I don't have time to talk to you about it today too much, but happy to answer questions, what we found was that there were patterns of how people use this information, and we had 6 different patterns. What I think distinguished a number of the patterns was that it wasn't enough to have support available, and it wasn't enough to have need. What's often driving the decision whether to disclose are those personal preferences and those perceptions of your workplace. That's often behind what people will ultimately use to make their decision. So again, happy to answer questions about that, but let me tell you a little bit about the tool, the DCIDE tool. What we really wanted to do here was adopt a prevention and support framework. We hear time and time again of people who find themselves sitting in a situation where they're being asked to explain a productivity problem or absences, and they're at that point having to make a decision whether to share. And so it would be really helpful if we could have people, use tools to think about this, understand your own preferences in advance. So we wanted to provide a tool that was personalized, interactive. It's about you, and evidence-based. There are resources and tools out there very often, and they're good. They've got to ask you to think about a lot of good things. But they often have like lists of pros and lists of cons, and you kind of go through it and you can be more anxious than you were at the beginning because you don't know what to do with it. So we wanted to try to make this more personalized and interactive, be relevant to a really wide range of conditions and different jobs, and give people feedback, help you chunk the information and distill it, link you to other resources so that we could try to help improve this process while at the same time protecting people's privacy. So no matter what you think is right for you right now, the tool can be maybe useful. So what the tool does is you would read through the introduction. Again, it's available in English and French. It's free. You read through the introduction, which just tells you a little bit about the tool, how it works, we think it helps, what it isn't. It's not clinical advice or legal advice. And then you are asked a number of questions about those different areas, what your needs are right now, what your goals might be, your preferences for communication, what you have available in your workplace, and what you think the culture is like. The questions are pretty simple. Yes, no, I don't know, or strongly disagree through to strongly agree on a 5-point scale. When you finish each section, each separate section, the computer, we've programmed this to kind of summarize your responses for you. So you just answer, and then we put you into different categories, for example. So if you answered the questions on your work culture, the computer would tell you, well, it looks like you feel largely supported in your workplace culture, or it looks like your answers are saying you don't feel supported or you're uncertain. Whatever the pattern is, you get some feedback. And so you're told, this is what your situation seems to be. This is what we're hearing from you. And this is what we think you need to think about based on what you've answered. So the goal is that we're trying to help distill information into something more manageable. So you don't have to think about 100 things, but 5 things. And then have you think about what the next steps might be, or some of the benefits or the drawbacks of where you are right now. So you just feel a bit more fully informed. Once you've gone through the 5 sections, you get a summary of all 5 of them. You can save that for yourself. We don't save anything. And then we point you toward some next steps and to the job demands and accommodation planning tool, which we think everybody should be filling out to think about concrete support ideas. So the next steps, for example, if you said thought you were ready to share some information, it would talk about, well, the who to share with and the how and the, how much, and give you some different scenarios and talk about advantages and disadvantages to them. If you're not ready to share, it talks a little bit about what you can still do. And in particular, leads everybody over to the job demands and accommodation planning tool. That tool walks you through your job. What are the demands of the job? And anywhere a person is having some difficulties, it provides very concrete solutions, ideas for different things that can be done, things you can do on your own without having to share, things that may be fairly informal that you may or may not need permission for, and then more formal accommodations. And there are versions there for the workers, and there are versions there for business owners, for supervisors, business owners, union representatives, in terms of the JDAP. So that's a tool just to sum up in terms of some takeaways. Again, we need to remember not everyone's ready to share information. Some people are, but not sure how to go about it. It's not enough to have supports available. We need to be considering all these goals and preferences. The decisions are complex. People are not all the same. People prioritize information differently, and that's all good. So the point of the tool is to try to help you understand who you are, where you are, and give you what you need. So I hope you'll check out the ACE website with both the DCIDE and the JDAP tools. So I mentioned it a number of times. They're free, anonymous, available in English and French. The JDAP has been out for about 2 years, almost 2 years now, and the DCIDE tool is new, only out since November. But since the end of January, over that 2-year period, we've had about 29,000 visitors to the ACE website from a number of different countries. And again, I hope you will check it out. I want to thank you. I'll leave this up for just another 10 seconds or so. But again, feel free, just Google JDAP or DCIDE or ACE, and you can find us, and I'm happy to answer questions. There we go.
Thank you very much. Excellent as always. So clear, so calm. Really helpful. All right, we do have a number of questions in our Q&A here. So one of them says, in my experience in a supportive environment, as soon as disclosure is done, there are assumptions made. And some people walk on eggshells and it's uncomfortable. What are some ways to shed the stigma and stereotypes?
I think so. Thank you for the question, and I think what you just said is something that you should feel willing to share with others. That this is what happens. I feel people are looking at me. They're wondering. They don't know what to do or what to say. So let me help you. And if you have preferences for how you want people to talk about it or not talk about it, I know people talked earlier about like keywords. This is a body day. I think it's okay to educate people, and people that you work with are grateful for that. To kind of know, not just again, not assume it's for everybody, but how you would like to go forward if you've shared some information.
Okay, great. Thank you. A few more here. What is your advice for someone who has to deal with many layers of management to get a message across, even within their HR group, regarding disability issues? I have already had another issue where I had to get legal involved because management kept pushing it off.
Yeah, and I'm very sorry for that, and it is a challenge. Sometimes larger organizations, although people would like support to be very one-to-one, me and the supervisor, let's figure it out. There are channels that have to be gone through, and it gets shared much more widely than people would like. One of the things we learned was that often these layers of management, people have misgivings about one another. So your HR may not trust your supervisor to do things well, and your union is, not necessarily trusting of others. I don't know how to solve all the complexity. I'm sorry. I will say, if you are a member of a union, remember that they are an advocate for you. Most unions now are dealing more and more with disability, and not thinking, oh, well, we only deal with the whole and salary kinds of things. HR wants to be helpful. They really, really do. And they are trying to educate themselves and move towards accessibility just being the environment. But they have to be in between you and the employer. So they are wanting to help, but they are not your advocates. And that's what they will tell you. That's what we hear from them. Supervisors often want to help too, but they have to think of the whole team. So I think understanding where people are coming from may be a start. But yes, if you need to get a labor lawyer involved, there are labor lawyers that do represent workers. There are, again, unions, or sometimes when there's not a union, there can be worker advocates and worker advocate groups that maybe you can contact to get some advice and education.
Right. Thank you very much. I think we've got time for one more question. I just want to dig into some questions related to the DCIDE tool. So there's one here that says, do you have any advice for someone who is reluctant to stand out and scared of sharing that part of themselves in the workplace?
So I would say, fair. That is fair, first of all. It's absolutely reasonable. I would encourage you to take the tool to maybe get some insights as to why that is. And then think about, because often people will over time say, I felt comfortable to share with a trusted colleague. And that was my first step. So think about maybe baby steps. Remember legislation. If you do need to share, you don't need to share a diagnosis, and you don't need to share symptoms. That can leave people saying, well, I don't know how to start this conversation. I really would suggest you fill out the JDAP, the Job Demands and Accommodation Planning Tool, because it will walk you through different job demands so that you could say, I have trouble concentrating where I am right now. There's a lot going on. I'm wondering if we could use this support. So it tries to give you the what to talk about, as well as some ideas, so that the challenge here is you don't want to sacrifice your job because you were afraid to get support. So there are ways around it, and people are asking for support all the time. Sometimes people have childcare. Sometimes they have caregiving responsibilities. So you're not alone in looking for your work to be a better fit for what your needs are. And you don't have to be right out there if you're not ready for that.
Okay. We have reached our time for this session, just trying to keep us moving and staying on schedule. Thank you very much, Dr. Gignac. It's always a pleasure listening to all of the research that you and your team have been doing. And there are so many resources available on the ACED website. So we'll make sure that that link goes into the chat so that folks know where to go to find some of these tools that you've been talking about.
Thank you. And feel free to email me as well.
Okay.
All right. Thanks, Melissa.
Thank you.